Money and medicine, how money has come to dominate over patient care and chronic pain patients, the plight of chronic pain patients. Two of my common subjects. I've combined them in one. You'll see why. It makes my blood boil. If you know me, you realize I'm a retired cardiac anesthesiologist, but I had my pain boards, and my wife's a chronic pain patient. Maybe this one hits so close to home. If you find this post valuable, repost it, like it, comment. If you don't follow me, follow me. So strap in on this one. This is absolutely infuriating. So there's a company called Pain MD. They ran a series of about 20 pain clinics called Mid-South Pain Management. They ran them in Virginia, North Carolina, and Tennessee. They went bankrupt in 2009, and finally the principals in this company were brought to trial in October of last year in Nashville. And four of the principals either pled guilty to or were convicted of healthcare fraud. The CEO actually was convicted of 13 felonies. What was the fraud that they were perpetrating? Well, it was sort of a pay to play. You're going to get this injection in order to get the medication that you need for your pain. Don't need the injection? Too bad. No injection? No prescription. This is the most unbelievably abusive story I've done a reel on. So this company did over 700,000 injections over an 8-year period. Some patients received as many as 24 injections at a single visit. Many of these were what we call tendon insertion injections. And that would be typically for something like tennis elbow, where it's a legitimate procedure. You inject the tendon near its insertion. You inject it with steroid or something called PRP. And rarely you do this twice, generally a single injection. But these patients had repeated injections. Two of the patients at this Mid-South Pain Management had over 500 injections. I mean, it's unbelievable. Like, what planet were these people living on? It? These people, these practitioners. And the poor patients were told, you're going to get an injection or you're not going to get the medication that you legitimately need. So one of the employees that was doing the injections did so many he had to stop because his hand became inflamed from overuse. I mean, this is just unbelievable. These people are going to be sentenced next year. As far as I'm concerned, the sentence should be you're going in for good, and we're going to give you about 20 injections every single day. Now, as a physician, we work under four basic principles of medical ethics. And every doctor learns these in medical school. First one is beneficence. You do what is best for the patient. Violated it. Number two, non-malfeasance. Do no harm. Violated it. Three, autonomy. Patients decide for themselves what is best for them. Violated it. These patients had no choice. They were pushed into a corner and said, I know you need your medicine, here comes the needle. And then fourth is something called justice, and that just has to do with equitable distribution of medical care among people. But they violated three basic tenets of medical care. I mean, I can't tell you how upsetting it is to tell you about this reel that there's people out there like that. Wow. So if you have been a patient at Mid-South, again, I'm so sorry you got involved with these people. Leave your comments if you've had experience. If you've been at other situations where you've been told, if you don't have a procedure, you're not going to get the medication you need. I mean, it just brings tears to my eyes to even talk about this. Leave your comments. I can imagine there are going to be some pretty tough ones out there. So, as I said when I started this, I'm a retired doc, cardiac anesthesiologist, did pain as well. When I retired, I wrote a book about my experiences in medicine. It's called Saving Grace, What Patients Teach Their Doctors About Life, Death, and the Balance in Between. No book like it's ever been written, because no anesthesiologist had ever described the secrets of what goes on in the operating room. The patient stories are very dramatic, and they're written from the perspectives of somebody who realized it was a privilege to take care of patients. Maybe because of that, the ratings have been so high. They average 4.8 on Amazon. You cannot find a single book on a single subject in all of Amazon that has a rating higher than 4.8, that's got at least 100 reviews. See what people have said, you'll realize why they felt so strongly. If you want to get an audible or a written excerpt, go to savinggracebook.com. Back on Amazon, it's available Audible, Kindle, and print. But for now, one of the most disturbing reels I've ever done to describe just how horrible these people are. If you've had any kind of experience like this, I'm so sorry for you, for my profession. But tell us what's going on. And if you find this valuable, repost it, send it on, like it, comment.